guest speaker for this year's breakfast lecture, Mr. Richard Carter. He has become known to you over the past few months as the COVID-19 Czar. Mr. Carter is also a member of our congregation here at Christchurch Parish Church. Kindly join me in welcoming him to present this year's lecture, Barbados' COVID-19 Response, What It Has Withstood. Mr. Richard Carter.
Thank you very much, Ms. Carter-Taylor. I want to acknowledge Canon Carrington, Canon Guy, Father Haynes, and Canon Isaacs, members of the clergy who are here. There may be others. If I miss you, apologies. And I want to say to Canon Guy that you have essentially determined part of the course of what I'm going to say today because of your sermon yesterday. When I attended church physically for the first time since the lockdown period started, that sermon was about, part of it was about response to criticism and how you manage and deal with that. And that has influenced a couple of the things that I am going to say today. Let me begin by stating the obvious, but the obvious that has escaped apparently some people. We are in the middle of a public health emergency. If you read the emergency directive, that's the first thing it says. Barbados, whereas Barbados is in a public health emergency. Just before I came here to the podium, I looked at my phone to check the latest statistics on COVID-19. There are a couple of sites that produce rolling statistics on the virus. So before we went to breakfast, the number of confirmed cases on worldometers was 18,261,548. By the time I left the podium to come here, it was at 18,272,000. So we had added 11,000 cases during the last couple of minutes between when I went to breakfast and when I got up to come to the podium. 11,000, and those are confirmed cases. Of course, we know, or we should know, that the number of confirmed cases is perhaps a half, maybe a quarter, maybe 1/5 of the actual number of cases because of the significant underreporting that is happening in many parts of the world. There was a story on the news this morning, for example, that in Iran, they suspect that the number of reported cases is only about 1/10 of the actual number of cases. Okay, Alex, you can cue me as to when I can start again. Okay, right. So just let me give you an outline of what I want to speak about. I've just made some brief notes. So I want to talk a little bit about the planning that has gone into the Barbados COVID-19 response, a bit about the policy framework, looking at the implementation of the COVID-19 response, and then finally I want to speak about the challenge of living with COVID-19, which is essentially where we are now and where we have to be going forward. I've chosen the subtitle, What It Has Withstood. Some of you would recognize that as a line from our national anthem, deliberately chosen because Barbados' response to COVID-19 has been characterized by a lot of the things that are within our national anthem and within our national pledge. We have, as a country, demonstrated a number of the positive characteristics that have defined us as a country, and those have stood us in good stead. We have withstood quite a bit, and therefore I've deliberately chosen a line from the national anthem as part of the subtitle of what I want to say today. So let me begin by talking a little bit about the planning. COVID-19 was first identified in Wuhan, China, as many people know, in December 2019, hence the 19 that is attached to COVID. Coronavirus disease 19 because it was identified in 2019. There are lots of other coronaviruses around that cause a range of things like the common cold and so on, but COVID-19 is specifically designated as the disease that causes, or as the organism that causes the disease that we are currently grappling with and dealing with. The planning for the COVID-19 response in Barbados started very early. That is one of the first features that characterizes the response in Barbados. Planning for the response started very early. In January, even before the World Health Organization had designated coronavirus disease as a public health emergency of international concern, even before it became a pandemic, when it notified that this was a public health emergency of international concern, even before then, Barbados had established its Health Emergency Operations Center. The Health Emergency Operations Center brings together a number of public health officials and other agencies of government, and some drawn from the third sector, charged with the responsibility of developing the coronavirus response in Barbados. Barbados had developed by February a national pandemic preparedness plan, and by early March, that national pandemic preparedness plan had been reviewed and essentially endorsed by the Cabinet of Barbados. So long before we had our first case, Barbados had already in place a Health Emergency Operations Center, a national pandemic preparedness plan, and a number of other elements of our planning. They established the Augmented National Security Council. So Barbados has a National Security Council which brings together the critical elements of government that are responsible for responding to natural disasters primarily. That was augmented by the addition of agencies like the Department of Emergency Management and a number of other agencies to constitute the Augmented National Security Council. That was also stood up and established by February in 2020. The Cabinet established a special subcommittee to deal with the response to COVID-19. This was also done by February 2020. That Cabinet subcommittee constituted obviously the Minister of Health, also the Attorney General. It constituted some of the other senior ministers of government, Minister of Foreign Affairs, because there was a critical foreign affairs element to this, the Minister of Education, partly because the Minister of Education substituted for the Prime Minister during her period of illness, but also because there was a critical impact on education, obviously, of COVID-19. So Minister of Education was also part of the Education and Smart Technology, I think is the title. We also had established in the COVID-19 subcommittee of Cabinet the minister responsible for social partnership relations and Minister of Labor. So probably about 6 ministers constituted that core element of the subcommittee of Cabinet, which met essentially daily to plan, to constitute, to deliberate on the COVID-19 response in Barbados. I was asked to join the government to take on the role of COVID-19 Czar, a title that I absolutely hate. But it was a title so designated by the Prime Minister. It is not without precedent either, because we did have, some people may remember, we did have an HIV Czar, and Dr. Carol Jacobs served in that role. And the Czar title, I think, is taken because of the overarching pan-government response to any incident or issue. In other words, it is not a health issue. If it were entirely a health issue, then you would not have a civilian with no specific health training as part of the responsibility for managing. But COVID-19 has huge implications beyond health, and that is perhaps one of the reasons why I was asked to take on the role by the Prime Minister. I had some experience in working on the front line with Ebola in Sierra Leone. Actually, I worked there for 4 years, leading the social mobilization and quarantine management and social response to Ebola. And I had also worked as a member of the National HIV/AIDS Commission in Barbados for more than 15 years as well, and did a lot of the primary research behind the HIV/AIDS pandemic in Barbados. So that's a little bit, I think, of the reason why the Prime Minister had asked me to take on this role. In addition to the fact that I had worked with her as a 26-year-old when she first came to government. So I've been working with her for 25 years as the first director of Youth Affairs. And she knows who she can give donkey work to and get it done. And I think that that was also one of the reasons, because whoever took on the role needs to know about the functionings of government, the ins and outs of government. And that also, as I said, is something that I have as part of my repertoire as having served as the Director of Youth Affairs in Barbados for the better part of 15 years. Initially, I was asked to take on the role from the beginning of April for 4 months. But I actually started taking on that role and engaging in a number of the meetings from about the middle of March, having taken no pay leave from my job as leader of the Climate Change and Disaster Risk Reduction in the UK Department for International Development. I'm giving you a little bit of this biography so you understand the context with which I came to the role. Two other elements of Barbados' response that I want to speak to. Testing. Barbados has done probably about 3 to 4% of its national population in terms of tests. There are a number of places that are reporting relatively low numbers of COVID-19 cases. One, because they're not testing, and two, because they're using testing that is not gold standard. Barbados has always used the gold standard PCR tests, which has a higher degree of accuracy and a greater degree of reliability than any of the other testing regimes that are available to across the world. It is not cheap, but Barbados has, as I said, always used the gold standard PCR tests. We have, from the beginning, been testing significant numbers of the population, as I said, and continue to do so. Any one of you could go to a polyclinic if you wanted to and get a test done and get the results within 24 hours. That is another strong advantage that Barbados has, in the sense that with the Best Dos Santos lab available to us in Barbados, we did the training way back at the beginning. So Barbados can actually get test results in the hands of the persons who are tested and in the hands of the public health officials within a couple of hours. So a plane lands at the airport, 200 people disembark, all 200, if they do not come with tests, are tested, and the public health officials can have the results by the next morning. This is an important feature of the response because it allows you to calibrate your response depending on what you are actually seeing in front of you. You're not going therefore by guesswork. And I want to publicly commend the excellent public health officials at the Best Dos Santos lab, who have so far turned around probably in the region of about 11,000 tests in the space of the last couple of months. Some of them working well into the night, working 16-hour shifts and so on, in order to bring this information to the public of Barbados and to the public health officials. The final thing that I want to speak about in terms of our overall planning, and why we came to this with a lot of advantages, is the establishment of the other facilities. Barbados custom built a tertiary care level hospital facility for the treatment of COVID-19 within the space of about 5 weeks. Custom built in the sense of renovating the old Barbados Youth Service headquarters at Harrison's Point, and which subsequently became the prison and now has been renovated. If you saw what it was before, and there's a point where it is going to be chronicled, where it was an abandoned ruin with trees growing up in the middle, to the facility that we have today, which is a world-class facility with over 30 critical care ICU beds and another 170 or so additional beds. So Barbados now has the capacity to treat over 220 patients in isolation at a cost, the facility costing close to 20 million Barbados dollars. Barbados currently has in the region of 100,000 test kits available to test persons for COVID-19. It currently has in excess of 30 facilities for the treatment of persons who have to be ventilated, so ventilators that are there in the critical care facility. More ventilators, in fact, that we have had at any point in our history as an island. Barbados has, of course, taken advantage of the offer of the Republic of Cuba to have over 100 critical care trained nurses available to it, working specifically on the COVID-19 response and staffing up the facility at Harrison's Point, in addition, as I said, to our own public health care officials. All of that speaks to a country that has dedicated considerable resources, has considerable capacity, has embarked on a process of rigorous, consistent planning in order to develop the response to COVID-19. No wonder, therefore, that agencies as diverse as the World Health Organization, CARPHA, Caribbean Public Health Agency, PAHO, the Pan American Health Organization, and a range of other agencies have commented positively on Barbados's response to COVID-19, citing it as, in effect, in many ways, a gold standard in terms of the response and the course that Barbados has taken. I'm not saying this by way of self-congratulation, because mistakes have been made along the way. Errors have been made, missteps have been made. We have not gotten it right all the time. But I'm saying this to point out to you that the response is not something that people got up one morning and thought through. This is a response that has been grounded in consistent planning, in following the science and the evidence. So Barbados never closed its borders. The World Health Organization has said that closing your borders is not an appropriate response to COVID-19. Barbados has maintained its borders open. What it has done is to require such a rigid regime for persons coming in that there was a point where commercial air traffic ceased, because the requirements of entry into Barbados were so rigid and stringent that persons were not prepared to give up 14 days in automatic quarantine to come into Barbados, and therefore there was a diminution or reduction in passenger traffic. Barbados was, however, able during that period to mount repatriation flights of its citizens, to mount repatriation flights of over 24,000 persons who were stranded at sea on cruise ships. And 24,000 persons passed through the port, through the airport, and back to their homes. Not a single person in Barbados got COVID as a result of that. Not one. And that is a testament to the public health measures that have been put in place to manage that, because many persons who were moved had COVID, but no one got infected as a result. In fact, throughout the last 4.5 months of Barbados's response to COVID-19, one public health well, not public health, but one official who was engaged in the response was COVID positive, tested COVID positive. One person tested COVID positive in the entire response, and this is a person who was engaged in actually part of the response. So having spoken a little bit about the framework, let me speak a little bit now about the policy that underpinned and was part of the COVID-19 response in Barbados. Whatever you want to say, whatever your political persuasion, Barbados mounted a consultative and consensus-driven approach to COVID-19 led by the Prime Minister. That was evidenced in the fact that meetings of the social partnership were mounted before every critical decision was made. Every decision in relation to when we declared the state of public health emergency, when we started the curfew period, when we instituted the process of alphabetized shopping, when we decided to reopen the borders, all of those decisions were taken in consultation with the social partnership, representing business, labor, government, and the third sector, all of them sitting around a virtual table in some instances, guiding and informing the decisions of government. This is important because you cannot go too far ahead of your country and in front of public opinion if you want to mount a successful response. If you are not prepared to take people with you and take them into your confidence, then it's going to be very difficult to employ the very stringent measures that are necessary in order to mount a successful response to something like COVID-19. So consultative consensus leadership has been one of the underpinning policies of Barbados' response. Another very early thing that was done, and very importantly, was the insulation of our premier healthcare facility, the Queen Elizabeth Hospital, as well as the elderly care facilities as part of the COVID-19 response. It was determined very early, we will at all costs protect the hospital insofar as is possible from COVID, because we have seen what has happened in other places when healthcare facilities become overrun, overtaken by COVID. And even though there were one or two cases that presented to and diagnosed at the hospital, none of those cases actually ended up causing further infection in the hospital, because those persons were isolated very early, tested, their COVID status determined, and then passed into treatment. The insulation of elderly care facilities was also critical. Barbados has an elderly population that is actually consistent with most first world countries. And with that elderly population comes a number of the non-communicable diseases. They're not necessarily directly related, but there is a correlation between them. A number of the non-communicable diseases that constitute additional risk, not of getting COVID-19, but of negative results once you've gotten COVID-19 and requiring extensive care. So things like diabetes, hypertension, heart disease, compromised immune system for persons who may be undergoing cancer treatment, and a range of other things present additional risks if persons actually get COVID-19. Barbados saw what has happened in many other jurisdictions. One of my most painful memories was seeing very early on in the pandemic a couple of elderly care facilities in Spain that had been abandoned, and elderly persons found dead in their beds because the healthcare persons had actually left and abandoned the facility. Hundreds of thousands, in fact, of persons have actually passed away in some of those elderly care facilities because of the peculiar vulnerability of that segment of the population. And right across Europe, and in fact into Latin America now, into North America, you are seeing the peculiar vulnerability of elderly care institutions. Barbados instituted very early a policy of no visits to elderly care facilities. That has been relaxed a bit somewhat now, but that allowed us also to have a measure of insulation of the elderly care facilities. And as far as I know, I don't know all of the cases, but as far as I know, not a single patient in one of those elderly care facilities has become COVID-19 positive as a result. Now, the third thing I want to speak about in terms of our general approach and policy is that Barbados has charted its own path while following the science and the evidence. This is important because while other countries around us were doing things that were irrational in some respects in relation to the science, Barbados has not found itself in a place where it followed other persons simply because it was the trendy thing to do. So while other Caribbean nations around us were shutting down their country and so on, Barbados always retained its country open. Barbados has followed a humanitarian and compassionate response to COVID-19. I spoke earlier about the thousands and thousands of passengers who were allowed to pass through our borders to be reunited with their families. Barbados took in the citizens of other countries when those countries turned their backs on them. Barbados always, to this day, said that Barbados will always be a haven for its own citizens. We will not close our borders to our own countrymen. A number of other countries have done this. There are still, to this day, thousands of persons who are stranded in many parts of the world, cannot get home, not because there's no available transportation, but because their countries have said, stay where you are. They've coined this phrase, shelter in place. It is one of those statements that sounds nice, but it covers up an uncompassionate response to its own citizenry. And I suspect that before this is over, there are countries that are going to find themselves at the other end of civil suits because of the constitutional breach of their rights by denying entry to their own citizens. But that is for another time. All of the cases that have come in over the past 3 or so weeks since the repatriation flights, with 2 exceptions, have been Barbadians. The 2 exceptions are the batch of nurses from Ghana who tested positive a couple of days ago, and I believe there were 9 of them. It is something that I'll address if I have time, because to have 10% almost of nurses who are coming from a country where you know there's significant COVID-19, to have 10% almost of those nurses testing positive does not look good. That were pretty soon isolated after they entered. And it makes me think back to, don't know, I asked Father Carrington if there are members of the media here, because one of the things early up in the response, the media emblazoned on a headline, Barbados enters new phase, community spread. And it was one of those sensationalized response to the fact that there were 2 persons who we could not identify where they got their COVID-19 infection. And we rely on persons to tell us where they were. And some persons had a vested interest in not saying where they had been. But because we could not identify where those persons had been, Maybe there were some places where there was not supposed to be. Because we could not, the newspaper emblazoned community spread threw Barbados into a panic. And I got all kinds of calls coming as a result of that. That was when we were at about 82 or so cases. Since that case, or since that instance of so-called community spread, we have probably had 3 or 4 cases of local transmission. So where is the community spread that the newspaper was referring to? Final point on the policy kind of approach is the humanitarianism that I spoke about. And this has not only to do with the fact of us responding to our nationals, and who among you, if you are stranded in some place as unforgiving in terms of its public health response to its own citizens, like some of the countries that I will not mention, who among you would not want to be home where your family is, where you are assured of the treatment of your country's resources being placed at your disposal? Who among you having a child overseas stranded running out of money with the university closed and telling the students to get off the university property would not want your children to come home where they can be cared for and looked after? And yet still, the government of Barbados has attracted criticism because it has allowed the repatriation of its own citizens. Well, the government has made it clear, Barbados will always welcome its own citizens regardless of their COVID-19 status. So, the COVID-19 response. We had 4 stages. Stage 0, no cases. Stage 1, when we identified our first case. Stage 2, when we identified our first case of local transmission. And stage 3, when we had community transmission or community spread. We actually went to stage 3 prematurely. Prematurely in the sense that when we reached 25 cases, the Prime Minister determined this is becoming serious enough. Let us institute stage 3 and follow the process where the public health emergency and the COVID-19 directive can be passed, allowing the government extra powers to regulate behavior to protect its citizens. That was the point, I believe it was late March, around the 26th of March or so, where government instituted the first lockdown, first COVID-19 response. We've seen some bizarre behaviors from Barbadians as well, copying persons overseas. We saw people just like in some diverse places as Australia and Canada and so on, rushing to buy lots of toilet paper before they bought food. So in other words, they got it the other way around. Because stuff needs to go in before it comes out. But people were rushing and buying up loads and loads of toilet paper. The government gave the assurance that Barbados was not going to run out of food, yet people rushed the supermarkets. There were a number of other assurances given in terms of Barbados' preparedness, but some of that was greeted by disbelief by its citizens, and some of the irrational responses followed anyway. So we got the emergency directives that were issued, and we cycled through them to a gradual relaxation as our cases came down and our management of COVID was attained to the point where we had 0 local cases. The state of public health emergency remained, but the curfew was actually lifted. That lifting of the curfew has resulted in, and in fact the declaration of 0 cases of COVID-19, even though the very next sentence after the Minister of Health declared the good news that we had 0 cases, his very next statement is, we are not out of the woods. We have to remain on our guard. COVID-19 is not going anywhere. Yet still, immediately after, we saw a relaxation of people's guard. We saw people being ready to go out and fet and party, declaring that COVID-19 is no more, that it gone. It ain't gone nowhere. I just cited 272,000 cases. They all started with one. We currently have, 32 or so cases of live cases of COVID-19 in Barbados. And we are going to get more as long as we continue to keep commercial air traffic and as long as we continue to allow entry into the country. And that's one of the last things that I'm going to address before I stop speaking. So we saw this relaxation of behavior, and this is where, Father Guy, I altered a bit of what I was saying, because I was going to come to admit to you that the COVID Czar is a real liar. Because I passed through Sheraton Food Court, counted 8 establishments where people were either not wearing masks or not wearing them properly, and stated that fact before an audience of representatives of one of the constituency branches that I had been invited to speak to. The media picked it up and said erroneously that I was forced to report these agencies. I wasn't forced to report anything, but I did call the COVID-19 monitoring unit and advise them that you should pay attention. The next day, having been told that the COVID-19 is likely going to pay them a visit, the media turned up at Sheraton. Now, if you know that someone said that you are in breach of the protocols, and the media is coming to interview you, what are you going to do? Then the media goes and interviews these people. The Czar said that you haven't been wearing your mask. Have you been wearing your mask? What do you think they're going to say? So, in other words, in fact, the manager and many of the business establishments of Sheraton Food Court said, we have been abiding by the protocols. So if I said they were in breach, and they said that they have not been in breach, they can't both be true. And since there are so many of them, it must be the Czar who is a liar. There have been other criticisms given of my approach. In fact, they've basically monopolized the whole pantheon of negative adjectives to describe the Czar. I am unfeeling, I am harsh, I am cruel, I am an idiot, I am possessed of power that I don't have, and all kinds of things. When all I have asked people to do is abide by the law, protect yourselves, or suffer the consequences. I have never disrespected Barbados or its population. I'm a citizen of Barbados. I'm committed to my country. The most harsh term I've used to describe them is hard ears. And I said that in the context of over 60 years ago, my mother telling me, hard ears you won't hear, one way you will feel. And I saw evidence of a lot of hard ears Barbadians. I have seen Governor Cuomo and other people describe their own population as stupid idiots for breaching the protocols. I'm not here to speak in my own defense, but I'm just simply giving you an example of where we have seen the citizenry drop their guard and find all kinds of rationalizations and explanations for why they do not abide by the protocols. The minibuses, you see them driving up and down, drivers, conductors, passengers not wearing masks. When I went as directed by the government and issued, this is a final and absolute warning. If you do not abide by the protocols, you will have to face the penalty. The COVID-19 unit will take you off the road. Immediately we got a response from the Association of Public Transport. This was too harsh. We should be warned first if you are found in breach. In other words, they wanted me to warn them that I was going to warn them. the level of irrationality that we have seen. We need to give them a warning. How much warning does COVID give you? How many chances does COVID give you before you get infected? Yet still we are finding all kinds of explanations, rationalizations, why we should not abide by the protocols that have been put in place. They are the law. We therefore have moved from compliance to complacency. And you walk around Barbados, you will see where many of the business places have dropped their guard, have relaxed the rigorousness of their observation of the protocols. And that's another thing. If protocols are not rigorously, stringently, and exclusively obeyed, any gap allows the possibility of infection. We have at least one medical doctor here and a couple of persons who are medically trained. They will tell you that infection does not need a big invitation. It just needs one single lapse, and that is the gap. Do people know how small a virus is? It has to be measured in microns. If you put 1 million of them together in a clump, you probably couldn't see them. It does not require anything but the slightest lapse in order for infection to occur. And that public health worker or working in the public health system that got infected, even though that person would have been wearing their PPE, a single lapse is all that it took. When I was in Sierra Leone working on Ebola, there was a very well publicized case, Pauline Cafferty, a Scottish nurse who became infected by Ebola. And when they traced back, it was in the act of taking off her PPE, personal protective equipment, where she might have brushed her face. And that is all it took for her to become very seriously ill. So what is the big thing about stringent, rigorous observation of protocols that will protect you, but more importantly, protect those persons who you may have at home? So those young people that are walking about, some of them in the United States of America, actively trying to get COVID. Can you imagine? In COVID-19 parties, trying to get COVID. Young persons here who don't care about a boy, and care about no COVID, but they have a mother or a grandmother. They may have an asthmatic niece or nephew. So they may get it and fine, be asymptomatic, but they may still be shedding enough virus to infect their mother, who is hypertensive or diabetic, or their grandmother. And there you see the consequences of your own irresponsibility and recklessness in the death of somebody who is near and dear to you. Let me conclude, been talking far too long, with the resumption of commercial air traffic and the protocols that are in place and living with COVID-19. Barbados has now allowed for the resumption of commercial air traffic. It is as much an economic necessity as a reality. We have had, up until the week before, over 59,000 cases presented to the National Insurance and Social Security Department for unemployment benefit. 59,000 out of a working population of about 134,000. We are actually very lucky that we live in one of the few countries in the world that has an unemployment insurance system. So 59,000, and they paid out at that time over 65 million Barbados dollars in benefits. Barbados also extended assistance to persons who are self-employed, who had been paid up, who are not eligible for unemployment insurance, but provided them with a one-off payment as a business interruption payment. And that's an additional, I don't know how much, over $1 million. We had the Adopt Our Families program, and Mrs. Carter-Taylor worked very closely with me on that and other elements of the COVID-19 response that I've not had the opportunity to speak about, where over 3,400 persons have now been given a benefit of $600 per month for 3 months, and it's now been extended for a further 3 months. These are people, some of them I went to their homes, who were so glad to see the money, who say, I can now buy something for my children to eat, or I can now pay off some of the bills where I've been threatened with eviction, and so on and so on. That has cost the Barbados government millions and millions of dollars as well. All of this money, and I spoke about the cost of the healthcare facility and so on, all of this money has had to come from somewhere, and it has had to come from somewhere in the middle of an economic crisis that the government of Barbados has faced, being in the hands of the IMF in terms of its economic response. Again, this is not a defense, it's a simple statement of fact that we are spending millions and millions and millions of dollars as part of the COVID-19 response without money coming in to the government. And therefore, the resumption of commercial air traffic is partly a response to the requirement of us being able to feed ourselves, because you could very well end up stopping people from coming in and dying of hunger or starvation as a consequence of Barbados not being able, I'm speaking figuratively in large measure, being able to meet its commitments. The protocols at the airport are such. Every single person coming into Barbados is required to present a negative PCR test on arrival or be tested on arrival. That negative PCR test, if you're presenting it, has to be certified by the public health officials. I've heard all kinds of things about people buying negative certificates and presenting them. The public health officials here are not dummies. They know what they're doing. They know what is certified. They're in touch with the labs that persons will present tests from. And in any instance, it is probably more expensive to go and get a fake test than to actually get a real one. But in any event, anybody presenting with a test has to be certified, and there have been a number of them who have come that have not been certified and have been told, go around the corner to our testing facility and get tested. So if you present with a COVID-19 certified test and you're coming from one of the countries characterized as medium to low risk, you are allowed to exit the airport. There's a period of observation that follows. You are screened, of course, by the port health officials. If you do not have a test, you are tested at the airport, and you are required to wait in quarantine, either at the airport or a designated hotel, before you can be released once that COVID-19 result is known. If it is negative, you go immediately, you are free to go. If it is positive, you go immediately to Harrison Point, which is the only place that persons are being isolated. There may be one or two exceptions in the judgment of the chief medical officer. So if you have somebody, for example, who has Down syndrome or is in a state of dependency, and that person has a house that is self-contained, the chief medical officer may allow that person, if they're in otherwise good health, may allow that person to be isolated at home. But that would be in extenuating circumstances, and it would be in the sole discretion and judgment of the chief medical officer. I am not privy to whether any of those decisions were made, because it is in the chief medical officer's discretion. I'm not interested. If anybody refuses a test at the airport, they are unlanded. That means that you are kept at the airport until you can be sent back out of Barbados from whence you came. The nonsense that has paraded and gained currency about persons, exceptions being made and so on, no exceptions are made for that. The Prime Minister has been very clear. We will protect the health of Barbadians. We will not make exceptions. Diplomats who have claimed all kinds of things have been told, this is Barbados. You're your diplomatic immunity extends only so far as the borders, and where you present to immigration officials, you must comply with the directives. And some of them have been taken off to be tested when they thought they could come into Barbados without the requirement of a test or without presenting a negative test. A citizen of Barbados who refuses to be tested goes immediately into quarantine for 14 days. So that person is not unlanded because they're a citizen, but they are taken immediately into mandatory quarantine. So no home quarantine. You go into quarantine where you can be followed. Barbados has made a distinction. In my view, I don't want to be critical of the government because I'm part of the government's part of the government agency and a representative of them. But Barbados has taken the decision that it has made a classification of risk and has followed a risk-based approach to the COVID-19 response and the protocols. So persons from high-risk countries are required to go into quarantine and to be tested within 7 days of arrival, regardless of what their COVID status or the test declares. So if it is negative, you are required to take a second test within 7 days. If you are coming from a medium-risk country or a low-risk country, you are not required to go into quarantine. And this is where the risk is. Because it does not matter if I have come from a low-risk or medium-risk country in terms of whatever COVID-19 status I have personally. And therefore, allowing persons to avoid a period of quarantine, even though they are coming from places that have COVID. So low risk doesn't mean zero risk, and medium risk does not mean zero risk. You have Canada, the United Kingdom, and so on, and countries like that in there that all have very active epidemics ongoing, pandemics. So this is where the risk is, that someone coming from a medium risk country, pre-symptomatic, incubating COVID, and therefore with a negative test, can enter the population and possibly therefore infect other persons. This is the gap. This is the major risk, as I see it, in terms of our current protocols and how they're being rolled out. So let me finish by saying that Barbados currently is in a situation where the risk to the average citizen, in spite of what I just said, is being managed by the government. It does not mean there is zero risk, and therefore there is the requirement on all of us to observe the protocols and protect ourselves. The decisions in respect of the allowance of commercial air traffic, those decisions are grounded on the basis that we have currently considerable capacity to manage COVID-19 cases. We will have to get upwards of 250 before our isolation facility becomes overwhelmed. I know that the government does have, and the public health officials do have, a sense of what that carrying capacity is. And if we see an increased importation of cases that threatens that threshold, then I know that the measures will be rolled back in terms of entry into Barbados, because we will not compromise the security, health security of the country in pursuit of economic gain. Your risk, therefore, remains at a level that was where it was at the start of this epidemic. As long as there's one live COVID-19 case, you are at risk. I urge you, therefore, to continue to observe the protocols and protect yourselves. I unfortunately did not get to speak about some of the other elements of the response, but maybe some of that will come out in the questions. So there was mental health response that was very ably managed by Ms. Carter-Taylor, working with me in ensuring that some of the negative mental health consequences were dealt with and managed. There was the response to the fact that increasing numbers of women were being impacted by this disease in terms of their care responsibilities, and upwards of 60% of the persons who got benefits from the adopt or families were mothers who were looking after children, of course, and a lot of that element of the response in terms of how we outreach to women was managed again by Ms. Carter-Taylor. She helped to organize and deliver an outreach to elderly population in Barbados, calling upon them and checking on their health status, particularly those living in districts where we know there had been COVID-19 cases, and that was also managed by her, working in collaboration with the COVID-19 response unit. So there was quite a bit going on behind the scenes that persons would not otherwise have seen, but these were also important elements of the epidemic because it did require and still continues to require a whole of government approach, and this is some of what we have withstood. Thank you.
Good morning. I actually have two questions. The first one being, you had stated that the Harrison Point was converted into a specialized facility today. After the threat of this virus has decreased, will the healthcare facility become a hospital in the north for the general public? The second one is, you also spoke about the food court at Sheraton. Can there be surprise visits so that these businesses can be caught in the act of endangering their employees and the general public?
Okay, the answer to your first question is yes, there is the plan for the facility at Harrison Point to be accorded some legacy status, as it is called. In other words, it is not going to be allowed, having spent $20 million there, to return to a state of disuse. So there is plan for turning that into some kind of healthcare facility post-COVID. The precise nature of that has not been determined as yet. In respect of your second question, yes, the officials of the COVID-19 monitoring unit do make surprise visits, but the truth is that it's ridiculous that we are forced into that situation, because if everybody is taking their own responsibility for the management of their health and so on and abiding by the protocols, then nobody should be turning up at you trying to surprise you and jump you into observing the law and observing the public health requirements. Yes, they are making visits. They're making visits to churches. They have made visits to churches and have uncovered breaches of the protocols there as well. And to other establishments. You would have seen some minibuses pulled off the road as a consequence of that, and the people from the Minibus Association complaining about depriving people of their livelihood while they're depriving people possibly of their lives.
Thank you.
My name is Andrea Ralston. I only have one concern. If I'm leaving home, walking to the beach or walking to Oysters, or the road is considered a public place, should I have on my mask?
Okay, there's currently no requirement in Barbados for wearing of masks ordinarily in public places. There's no requirement as it stands for the wearing of masks. When I walk out that door, I will put on the mask to walk through, but once I'm out that door, there's no requirement of me to wear a mask going to my car or walking, exercising by the gym or whatever. That is the current status. It may change, but it is not a public health requirement. There are requirements, however, under law for going into a range of places, business places, restaurants, shops, on public transportation. Those are places where it is absolutely required.
My name is Ingrid. As a mother and a teacher, my biggest fear is another complete lockdown. It was a most difficult set of circumstances to get accustomed to. What are the conditions that would cause us to have another lockdown? Like initially we had to go up to like 24 cases, and then we had these. Now that things have changed, have new parameters been put in place? I just want to know what to listen out for.
Yeah. Actually, the conditions for another lockdown exist. Those conditions are the irresponsible behavior of Bajans not observing the protocols. The Prime Minister has used the analogy of accelerator and brake. Accelerator in the sense that she will allow space and freedom of movement and so on. Brake, that those can be curtailed at any point where they are not observed. It will be difficult politically to have another lockdown now once people have gotten used to it. But this Prime Minister is not afraid of making difficult political decisions. Secondly, I think the major public health reason is in what I said earlier. If we reach a threshold of cases where we see us going beyond the capacity of Harrison Point to manage, if we see an introduction of community spread of COVID, that is what is going to generate another lockdown. And one of my big concerns is that one of the cases that tested positive recently is someone who came in, tested negative, was allowed in, and now, I'm not sure what the period is. I heard a date, but I haven't gotten it officially. But now, sometime later, has tested positive when they were about to go out. Now, that person was obviously positive for some time. Who did they interact with? They're now doing the contact tracing. Who did they possibly infect while they're there? So the major risk of a lockdown is if we start to see community spread of COVID in Barbados. And I'm sorry, yeah, you can come to the mic. Let me just finish this in terms of your fear of another lockdown and how difficult it is. In my own home, I have 2 sons. I'm called the oppressor of the masses. Because, and I mean, they're wonderful boys. They have actually curtailed some of their own social activity because they are aware how it would look in this small, judgmental Barbados for the Czar's son to be seen somewhere where they perhaps should not be, or without a mask, or with a whatever lapse. And they are aware how that would play out. And they have stuck, largely speaking, to their homes. So I'm the oppressor of the masses in my own household.
Good morning. My name is Shireen. Thank you for what you've been doing. My question, 2 questions. Regarding testing, you said that 3% of the population has been tested. I want to know if that is enough, and are you testing the right people? Because I got the impression that I had to have symptoms to be tested. But then I was told that there are people who do not exhibit symptoms. So should it be that you have random testing of persons to determine the true figure of who has COVID in Barbados?
Yeah. Okay, that's a good question. The truth is that if you do not have community spread, if you don't have evidence of the spread of the virus in the community, it doesn't make a lot of sense going out doing random testing. So Barbados is really different in terms of its, and much of the Caribbean, in terms of the current state of the pandemic, in the sense that there is no significant spread of the virus in the community. And therefore, to go out there and test people randomly is, in some respects, a waste of a test because it is not going to generate anything useful. If you do have spread in the community, it would make sense to do, and that is why many of the places that currently have widespread evidence of the pandemic in their communities are actually doing some of this. Having said all of that, however, I said earlier that anyone in here who wanted to get a test can go to the polyclinic today and get a test free of charge. And Barbados has in fact ramped up its surveillance testing of its population. So lots of people going through the polyclinic have actually been tested for COVID-19. Lots of people going through the Queen Elizabeth Hospital have also been tested. And these are people who don't necessarily have COVID symptoms, but they're doing that testing as part of ramping up and expanding the range of testing.
Okay, second question, a personal question. In terms, I have a daughter who's 5 with asthma. How concerned should I be? Because I'm not hearing really children being either tested or not many being found to have COVID. But I was told because she's having asthma, she would be in the high risk category. Should I be very concerned at this time, especially with the introduction of school, reintroduction of school? Should I be concerned?
Yeah, so I'm trespassing now on the premises of the medical authorities because
Right,
I'm not a medical
I know,
person.
right.
And perhaps I should invite one of the medical practitioners in the room to the mic. But the risk of getting COVID is there for everybody.
Right.
So there's no differentiation in terms of risk of getting COVID. Although younger persons who have stronger immune systems are probably a bit more protected. However, there have been newborns, 1-2 days old with COVID. There have been centenarians with COVID.
Right.
In terms of the asthmatic child, the risk of an adverse outcome for a child with asthma is probably greater because of the respiratory implications of something like COVID-19. And you can imagine if somebody who is asthmatic gets a respiratory or an infection that attacks not only but partly the respiratory system, that person is at increased risk.
Yeah, but I'm hearing rumors that children who have asthma may be able to handle it better because they're accustomed to their immune, to wheezing and...
Yeah, I've heard lots of rumors too. But if I'm the parent of a child with asthma, I'm going to do my level best. In fact, if I'm parent of a child, full stop, I'm going to do my level best to protect that child from getting infected because different people handle the same medical condition very, very differently. And everybody knows that two people can be exposed to the identical thing, and one person goes this way and the next person goes that. So do your best to protect your child from getting infected with not just COVID, but with anything else that may likely compromise their situation.
Thank you very much.
Good morning. My name is Udine. I pass by the bus terminal every evening in Bridgetown. There where the people sell and stuff like that. And in that area is very crowded. You usually have traffic block coming up there. So I wanted to know, and the people don't have on any masks. A lot of people are there drinking and socializing and they don't have on any masks. So I wanted to know if any of the personnel goes and check that area.
Yeah, I'm not sure they do. I have video on my phone that I took myself outside the Queen Elizabeth Hospital at the back there to the Beckles Road entrance where there's a little canteen with hospital workers all up in one another, as we say in Barbados. None of them wearing a mask, drinking, socializing, and carrying on. Fresh out of the Queen Elizabeth Hospital with members of the public, none of them wearing masks.
That area too.
Now, what risks are there? I spoke about the insulation of the hospital. What risks are there potentially taken back into the hospital? I reported and sent the video. I didn't rely on anybody. I took it myself to the chief medical officer and to the CEO at the Queen Elizabeth Hospital. I don't know if any action was taken because I passed back there yesterday and I saw them shifted a little further under the trees, but still doing the same thing. So, I mean, you do not have to go very far in Barbados to observe lax observation of the protocols. I took it upon myself to drive from Oystons through Bridgetown down the west coast as far up as St. Lucie and went to about 5 fish markets. So Oystons, Bridgetown, the one at Weston, the one in Speightstown, and there is another one in between there, Fitz Village or somewhere, and down to 6 Men's. I counted about 4 fish vendors wearing masks. No, sorry, 5 fish vendors wearing masks in those markets. I reported it to the Minister of Health and the Minister of Maritime Affairs. They went and checked, the Prime Minister herself went to the Bridgetown Fish Market last week and spoke directly to the fish vendors about the need to observe the protocols or else she will shut down the market. The next morning, the COVID-19 unit reported that persons were there without masks. If you go down in Oystons now, in the fish market, you will see people selling and so on without masks. So that is our reality. That is our risk as well.
Thank you.
All right, so the question is, can it be made mandatory? Yes, the government can make the wearing of masks in public mandatory, but those places that I just described, it is mandatory. Every single one of those fish vendors or operators of other food establishments or persons on the minibuses, every single one of them is subject on summary conviction of a fine of $50,000 or a year in prison or both. So if you, any of you in here, go on a PSV without wearing a mask, you are liable on summary conviction under the law to a fine of $50,000 or a year in prison or both. So it is the law, and it is mandatory.
Recently, I heard from a health official that if you, let's say in the supermarket, and the conveyor belt is going, and the person spritz the conveyor belt to clean it, and the virus is on it, it could actually kick up the virus onto the people that are close around it. That is what I heard. I've witnessed that not only in the last few days, I've witnessed it twice. The next thing, there's a very popular buying club that I went into, and I saw no form of sanitizer other than when you get to the door and they spritz your hands. But when it comes to the conveyor belts and things like that, I have seen nothing. One person goes and the next go on and everything like that. I'm seeing no sanitizing. I want to know what you all are doing in relation to reviewing the protocols for those situations. And question number 2, when are you going to look at the situation? I know people keep saying that it poses no threat, but I still would like to know, when are you going to look at the situation where health officials change their clothes when they get to work instead of wearing it in public vehicles and things like that?
In relation to the first question, all of those establishments have had the protocols of sanitizing supermarkets and other places like that from the Senior Environmental Officer of Health or the Deputy Chief Environmental Officer of Health, who would have provided those protocols to those establishments. So if persons are spritzing the conveyor belt, that would have been either at the instruction of the Senior Environmental Officer of Health or on the public health officials in terms of the containment or reduction of the risk of the transmission of COVID-19 at that point. So the basic point is that all of those establishments are supposed to be observing some of the things that you mentioned. So if you go to an establishment and they're not observing the protocols, you can actually report it anonymously.
Good morning. I am Charlene, and for the last 5 to 6 months, I've been home thinking about when I would be able to go back to school. Recently, when I saw something on the internet, it had that two young boys were trading masks because one looked cool, and then it had to close on, and then the school closed the next day. So I was thinking, instead of the little one, the small, like in primary school, they would at least continue with online classes, and the older ones who can at least try to handle themselves go attend school. I was wondering when and how school would work out.
Well, first of all, I should congratulate you on thinking about going back to school. I'm not sure how many of your fellow students share that ambition and thought, but the seriousness behind your question, actually, that is one of the biggest challenges currently facing the government of Barbados and the Ministry of Education in relation to the resumption of school and the circumstances under which school will be resumed. It is a big challenge because even though we had a limited reopening of school to permit both external exams and the common entrance exam over the past couple of weeks, the full resumption of school is going to present a very different challenge. And it is a challenge that the government is obviously aware of and they're planning for. There will be almost certainly some version of online school, but that has its limitations, as we have seen, and that has its challenges. So what they finally come up with will obviously have to be discussed with and approved by teachers and by the general public. And hopefully they will also involve students as part of the discussion in terms of what protocols are put in place. But it is a challenge that has not been fully worked out, but it is one of the major challenges that we are going to face in the next couple of months.
My name is Denise Douglas. Just a few days ago, I went to Sheraton just for a quick something, and when I got there, I realized that I had forgotten my mask. I did try to get in, but I was not successful. But the person who was there, he said to me, "Do you have $2?" Or I think it was $1.50. I didn't. I gave him what I had, and he sent a lady who came back with this mask. Now, not everybody can take $1.50, I think it was $1.50 or $2, to buy a mask. And I feel that there should be certain areas where, first of all, if you produce these, you could probably buy one for $5, for 50 cents, I don't know, but much less. And if there were areas in the West, all over, where people could be told to go and buy masks cheaply. I mean, I've had a friend who paid $40 for a mask. I couldn't believe it. But there are people who can't afford even the $2 to buy one of these. And if there are certain areas set out where you can go and you can buy a mask for a lot, if they're produced in large quantities, you could then buy one for a lot less. And I think that this is something, because people, it's not easy for a lot of people, you know, to spend that sort of money. That's my question.
Okay, thank you very much for that suggestion. I'm actually going to pass that on to the Health Emergency Operations Center as a suggestion that you make masks available in public places for persons who may either have forgotten them or who may want to buy them at reduced cost.
Hey, good morning. My name is Kinez. Can you explain to me what is meant by herd immunity? I've been led to think that the more people that contracted the virus, the better it is, but I am seeing that is not the case.
Okay. Again, this is a little bit outside of my expertise, but I'll do my best. There is an epidemiology, that is the study of disease. The principle that if a significant enough part of your population is immune to a disease or has some level of immunity, that can act as a barrier and restrict the spread. It was actually a principle that applied to a number of countries early on in the epidemic where they were not actively trying to prevent infection. They weren't encouraging people to get infected, but the principle behind it was that if a significant enough proportion of that population was protected by virtue of having had the disease and therefore having some immunity, then that can restrict the onward transmission. Because when the disease gets to me, because I have had it before, I will not get it and will not therefore transmit it to the other persons that I'm in touch with. There are a number of risks associated with this. First of all, COVID is very new. We don't know a lot about it. We're still learning a lot about it. We don't know how long or whether, in fact, even if immunity exists. There have been a couple of cases where persons have possibly gotten COVID again, and that is being investigated. So with something like a very new disease, with all the mutations that can happen with a disease, the principle of herd immunity has now been discarded by almost every country. And what they're trying to do, you're finding countries now that were going down that route are now going down the route of test, trace, and treat. Basically, the approach that Barbados has taken, where we have tried to identify everybody, we've tried to isolate them, and we've tried to treat them as the means of preventing spread.
Thank you.
Just a few comments I want to make. As far as the asthma is concerned, asthma is just one of the many diseases that you identified where if you get COVID, it could lead to a worse outcome. So the important thing is control the asthma. Use those preventive medications that you have all the time. Don't wait till you get an attack. I noticed that you visited all the fish markets, but not the upscale restaurants on that coast. At least it didn't say you did that, but we need to also visit that. The public are questioning, not you because you're not part of the monitoring unit per se, but why the monitoring unit is not doing that. I think because of this zero, when we had no cases, it caused a lot of complacency and people really relaxed a bit too much. And the message, as you said, they just heard the first sentence and didn't hear what went on after that. And therefore people relaxed and are still relaxing. No. I think we need some more public service announcements. Not only on CBC, but using whatever media. Yes, there are the posters out there, but people haven't really been catching on. I don't know what method. You have the experts in the ministry who can better get that message over. I do my little 2 cents worth some mornings a week to get the message off, but people still not listening. The proper way of wearing the mask. I see people in here with the mask upside down, inside out, and with the noses exposed. At my church, I go to Christ the King, I got up and said, masks are not like condoms, or most condoms, one size fit all. They're not one size fit all. You have to get the right size to fit you, and you need to adjust them. So people need to do this. And my other comment or question is, what is the correct way to take those temperatures, the non-contact thermometers? I have seen people using the wrist. I've seen people using the forehead. I've seen people using the side of the head. I've seen it behind the ear. What is the correct way of using that non-contact thermometers? Thank you.
Dr. Lord, you tell me. And I will pass it on.
You're the expert.
You've certainly taken many more temperatures than I have.
I tend to take it mainly at church. But no, I think the wrist thermometer, using the wrist is not accurate at all. Do not accept that. I see that. I mean, I was shocked when I got asked a question on Morning Barbados about using the wrist. Using the blood pressure, taking blood pressure at the wrist is not accurate either. But taking the temperature of the wrist is not accurate. So the forehead, most of the thermometers tell you how far you should be because people are really far from you. So you get 33 and 34.
Yeah.
And I just say you shouldn't be alive with those temperatures. So there's a specific distance. So those of you in the church who are taking temperatures, the box instructions just tell you what distance it is. It's specific to the instrument, and that instrument is a similar one to what we use at Christ the King. So I don't know if the diocese bought a lot and got them at a cheap price. So there must be a distance, and it's better to take it at the forehead or to the side of the head, but definitely not at the wrist.
Okay, thank you, Dr. Lord. And
yes, I think we need to do a little bit more.
Yeah.
Yeah. It depends on the instrument. The instrument tells you if it's 2 inches, 6 inches, or whatever. Yeah.
Okay. All right, thank you. And I myself have also seen, thanks, I've seen situations like...
Or Fahrenheit and Celsius. Yeah, there are two degrees of measurement, Fahrenheit and Celsius. We use 37.5. It is Celsius, or 99.5, I think, is the Fahrenheit. Fahrenheit is the old-time... USA uses Fahrenheit. So if you got them from USA, you have... But some of the instruments can change. So usually Celsius is easier. And by the way, if you have a temperature of 37.2, that could be a fever. But we use 37.5 as a guideline. The CDC used 38. The Center for Disease Control used 38. So and the other thing is, be careful of all this information and misinformation out there. Go with the science, go with the recognized sites, as he mentioned. The Barbados Government Information Service is what I use a lot to get my information. The Center for Disease Control, the World Health Organization, CARPHA, and Pan American Health Organization. All these WhatsApps that are coming left and right and center, don't get too involved because, yeah. Thank you.
Okay, thank you. So, yes, I've seen temperatures recorded where persons should be dead because the temperatures weren't properly taken. I've also seen people taking temperatures and not even looking at what the temperature is. So you're just going through the motions, pointing the thing, and you're free to go. The proper protocol is that the temperature actually should be read out to the person whose temperature is being taken, and obviously some training should have happened in the use of the thermometers before these infrared thermometers before they were actually applied and used.
Hi, I'm Patricia Straker. I would like to find out what procedures are in place for the disposal of the biohazard testing materials.
I don't know. Sometimes people are afraid to say they don't know, but I don't know. I know that the public health officials do have protocols in respect of the disposal of biohazard materials, and some people are a lot focused on COVID-19, but there are lots of other things much more hazardous that have to be treated and discarded every single day. And those are being managed by the health authorities. So I don't know what specific protocols are in place, whether they use incineration or what, but I trust the public health authorities to have gotten this right, because it is not something that they just started doing with COVID. They have been dealing with biohazardous materials for time immemorial.
Okay, so what about, let's say, biohazardous materials being transported from the airport? Suppose that person gets into an accident.
Yes, again, they would have whatever protocols they have in place for the management of stuff from the airport. So I know, for example, that when samples are taken at the airport, they are transported under a security arrangement with the Barbados Defense Force, and that they're taken directly to the lab. I believe they have police outriders as well to clear the traffic, because there's an interest in a fast turnaround. So they are transported under security protocols from the airport to the lab.
Hi, I'm Cassandra. I may have missed some of the information because of working, but out of curiosity, I was concerned, have you examined if there's a relationship between the actual being on board the aircraft and COVID-19? And then I came out the airline industry, so I was just curious about these things in terms of crew turning around. I know they used to overnight and stuff. What happens in a case like that? And then the last I heard, it was something to do with 2 possible in-transit passengers. How does that affect the system in terms of these 2 in-transits going on the aircraft and continuing further?
Yeah, so as far as the airlines are concerned, there is the possibility of transmission of COVID on a plane, just like there's the possibility of transmission of COVID in any place where persons are in close proximity. The risks, as I understand it, are not as great as you would ordinarily imagine because of a number of the measures that the aircraft take and because of the aircraft system of delivering oxygen and circulating air and so on. But there is risk. In terms of the turnaround of pilots, I think what is actually being done is that many of the aircraft are using crew, an extra crew, who then turn around as passengers. Okay. So you would have an additional crew that travel on the aircraft, and then they go back as passengers while the crew that were resting take over the flight going back. Because obviously there's turnaround time that pilots and so on are required in terms of work. And you had an additional question. Oh yes, the in-transit passengers. In-transit passengers are also required to present a COVID-19 test to be in transit in Barbados, even if you're just going through. And the reason for that is that we need to know, we meaning the government of Barbados need to know if someone's COVID status in case there's cross-infection of someone else that they travel with or that they were in proximity to. So even in transit passengers, their COVID status is required. They may not get it in enough time for onward travel, but there have been a couple of cases where that has happened, and we have then reported it to the country where the persons are traveling on to. So it is less for the person to know and more for us to know so that we can do our contact tracing in case they were in contact with anybody.
It is with pleasure that I stand before you today to give thanks for all the gifts on display. First, to God for affording us this opportunity to gather again in our church community. Our featured speaker gave us so much information. Mr. Czar, for you, we have only admiration. Your address to us about the COVID-19 disease has reminded us to wash, sanitize, yes please. To all the servers and cooks with your great execution, for this you certainly deserve our sincere recognition. Thank you for serving us on this special morn. I'm sure to your talents many will be drawn. Let us not forget the ushers for their great care in taking our temperature, ensuring we're clear of fever and germs. They sanitized us well. Social distance, 3 feet, and a squirt of Purell. Once more, we say thanks to our IT team, always here to enhance the experience or stream. Your goals and aspirations will have no bounds, and as you make strides to higher grounds. To all who made a donation, our gratitude we bestow for helping our breakfast always to grow. Many of you give a donation each year, ensuring the church provides a succulent fare. Let me not forget to thank the audience for your support, because we all know COVID ain't making no sport. Your dedication you have surely displayed. Thank you, audience, for the effort you made. Finally, to our rector, clergy, and staff, a thank you I extend on the congregation's behalf. With your help and guidance, this event has grown, and many happy times together we have known. Thank you all for allowing me the time to say thank you in this little rhyme. May you all have a most enjoyable day. God's blessings to you as you go along your way. Thank you.
those of you who would have been following our digital ministry would know that Julia has given us a poem every now and again, and of course on occasions when we would have had programs in church. So we give God thanks for that gift. God bless you. Let us stand for the grace. May the grace of our Lord Jesus Christ, the love of God, and the fellowship of the Holy Spirit with us all now and forevermore. Amen. Thanks once again to one and all. Have a pleasant remainder of the day. And whatever you do, stay safe, my friends.